All right, good morning. I am recording this so that it can be used it'll be found in the Canadian, the Queens of Perimenopause. All right, I'm just letting you into my morning routine. So I had a couple questions yesterday about periods in perimenopause, and I just wanted to address those questions. So, one of the questions was, we think, when we're first learning about menopause, that eventually our periods will just stop. And for most of us, actually, what we end up with is a lot of disruption. So I made a video last week about irregular periods, which pretty much includes everything. Anything you can think of, bright red, brown, clotting, pink, lots of blood, hardly any blood, all of that. Periods on top of periods, one after the other, a period that doesn't stop, a 28-day period, all of that is considered potentially part of it. Now, if you have abnormal bleeding that's outside of your regular, you do want to get checked. Don't leave a 28-day period, right? That's dangerous. It could be a big problem for your iron levels. This is my morning coffee with my mushroom in there. Drinking it black because I am doing a mild intermittent fasting, and I'll have my breakfast in a bit. So I thought, let's see what some of my favorite books have to say about periods. This is one of my favorites. This is from Madeline McKinnon. She has a lecture in the Queens of Perimenopause. It's at the gold level, but her book is amazing and goes over quite a few ideas about what's happening. So in the class that I just ran on hormones and medical hormone therapy, menopause hormone therapy, hormone replacement therapy, whatever you want to call it, if you look at your period chart, your estrogen peaks when you ovulate, and then just before your period, there's a real dive. And a lot of us in perimenopause are having horrible symptoms because it's actually our progesterone that goes low first. So the first rule of defense is offering a little bit of extra progesterone. So there are different ways you can go around doing that. I have a prescription for micronized progesterone, which helps a lot. You can also ask for a progesterone cream from your doctor. You could go through a naturopath and ask for bioidentical progesterone. But it may suppress ovulation. So it's not great if you're trying to get pregnant, which some people, if they're starting early, are still trying to get pregnant. So be aware of that. So if you can produce your own progesterone, there's a lot of benefits to that, right? Producing your own progesterone. So you can eat and look for nutrients. So here's the ones that are recommended that could potentially help with this big dump that happens just before you get your period and have all your premenstrual syndromes, your premenstrual syndrome symptoms. So selenium is important. Quality sources include Brazil nuts, shellfish, grass-fed beef, and bison. Vitamin B, so we want to increase the foods that have good source of vitamin B6. Sunflower seeds, sesame seeds, turkey, wild cod, chicken breast. So you can also use sushi or raw cheese. I'm really enjoying seeds, and I wanted to look to see if she has anything in here on seed cycling, but I didn't find anything on seed cycling. But if you are just like, maybe you're bored stiff of what you've been eating and you want some good ideas about stuff that might potentially enhance your natural hormones, like we always want testosterone. We have trouble getting testosterone. There are suggestions for your low testosterone so you can increase your natural production. Zinc, vitamin D, magnesium, vitamin B6, selenium, and omega-3 fatty acids. Those are the ones that are top of the list here. And we have talked about that. If you watch, and everyone should watch, The Hormone Nurse, her lecture is at the free level. It's in the speakers section. That will cover you for a lot of that stuff. And then I had a quick peek at this. Is one of my other favorite books, Next Level. It is a workout book, which turned me off, actually. I almost didn't buy it because of that. Not really into working out. I mean, I do work out. I enjoy the benefits of working out, let's say. But these guys covered so much in this book. Their explanation of perimenopause was just excellent, easy to understand, and definitely great to work with. So erratic periods, right? That's really what we're dealing with, where we may or may not have a period for a long period of time. Ha ha ha, long period of time. So they're talking a lot about working with carbs. You're more sensitive to carbs during menopause, but you still need them in your system, right? So thinking about adding in high quality carbs. So white bread, white rice, stuff like that can just go switch to whole grains. That actually made a difference for me. And like having one piece of whole grain toast and two eggs instead of two pieces of toast, um, that made a big difference for me as well. And they're actually suggesting a combination of 10 to 15 grams of protein, which is a lot of protein. If you start looking into your protein intake, we're chronically low in protein, and 40 grams of carb, about 200 to 220 calories. So make sure that you're really being careful of that. And then their recommendation, again, for cramping is magnesium, omega-3 fatty acids. And this one is interesting too. So be careful with this if you have acid reflux, indigestion, or stomach problems, but a low dose, 80 milligram aspirin a week leading up to your period. So the aspirin suppresses the production of prostaglandin. It's terrible. I'm dyslexic, so words that aren't English. Prostaglandin E2. This is the one that's associated with your menstrual cycle. So it'll reduce your cramp causing chemicals. If you wanted to try that, if you can tell where your week is leading up to your period, and that is another part of frustration. So that can be difficult. One of their suggestions is keep a stash of products. So make sure that you have what you need, your gym bag, your glove compartment, your office. And then menstrual cups are a good suggestion if you're having unusually heavy flow. Sometimes that can really work. I don't know if a lot of people don't really get what it is, but it's basically just like sort of like a diaphragm. It's a little cup that just sits on the cervix and collects all the menstruation. It's actually really easy to use. I personally felt like it irritated my urethra, so I didn't like it. But then, you have to try it. And then they're suggesting period underwear, thinks or nicks. I felt like part of the problem with the periods was not knowing what to expect makes you feel really a lot more anxiety about it in general. So one of the questions was, what do you do for comfort when you get an unexpected period? You can look at, your sleep habits, making sure you're really comfortable, having a bath but not too hot, using a muscle relaxant, heating pad on your belly. I really like Midol. Midol combined with an ibuprofen works really, really well for me. You can look into all of that, comfort care, and then also mindfulness, because when you're telling yourself, oh my God, I've got a period and it's terrible, that's going to make you feel worse. So if you can work on detaching, that can make a big difference. I also just wanted to show you another one of my favorite books, The Hormone Cure. This is my favorite lady. She's my teacher, Sarah Gottfried. She's changed her name back to her maiden name now, Szal, Szal. I took her class, Beautiful Hormones, and that book has a lot of stuff. It doesn't have anything about seed cycling, though. I was looking for seed cycling. It's not hysteria. Definitely of benefit to get this one too. And you're going to find a lot of the same things. So she actually is recommending cognitive behavioral therapy. That's basically something you can get with any medical health professional. I do that and I can teach you that. Controls depression, anxiety, and decreases the intensity of distress. So it's the distress that increases with the PMS or the PMDD symptoms. So relaxation and stress relief, that's where the 21 days to fix your sleep comes in. Probably the person that asked me yesterday was wondering why. Why did I suggest the 21 days to fix your sleep? That's why, because it reduces your stress. And the other question was adding in HRT and having a change in your menstruation. Like maybe you haven't had a period for quite a while and then you start taking hormones and you do have a period. That's not unusual at all. I didn't find a reference to that specifically, but I have heard that again and again. Expect that you may have period changes when you add in hormone therapy. It's not unusual at all. So anyway, I plan on doing this probably more like once a week, depending on what kind of questions I get, and answer them. I'll go live like I have done this morning, and I will also make the effort to so that anyone who joins the Queens of Perimenopause can take advantage of this later. So I hope that you have a great day.